You sit down to eat a simple, healthy meal, but instead of digging in, you catch yourself staring at your plate, filled with worry. If you have arthritis, you already know the feeling. The moment you mention joint pain, you are hit with a flood of well-meaning but terrifying advice from friends, relatives, and every corner of the internet. You have probably heard it all. They tell you dal will spike your uric acid, that rice is practically poison for your knees, that a single tomato will ruin your joints forever. It is exhausting trying to figure out what is actually safe to eat. So let's step away from the panic and look at exactly what the science says about diet and arthritis. To understand how food affects your joints, we need to look at what's happening inside. Conditions like rheumatoid arthritis, psoriatic arthritis, or severe gout represent an immune system in overdrive, creating a persistent internal fire that damages your joints. If a house is engulfed in flames, tossing a single bucket of water on it won't do much. You have to call the fire brigade. This diagram shows the role of medical treatment. Specific medicines like pills called methotrexate or advanced precision-guided treatments called biologics work like heavy-duty hoses. They target the source of the inflammation and are essential to getting the disease under control. Now, where does your diet fit in? Think of it as your daily house maintenance. Good nutrition works by clearing away dry leaves and making the structure less flammable, which helps prevent future fires from spreading. View your diet as an incredibly valuable supportive therapy. While it provides the foundation for health, your prescribed medical treatment remains the primary way to stop the damage. With that foundation laid, let's look at the actual menu and clear the names of a few commonly accused suspects. First on the chopping block is the idea that eating any kind of dal will automatically spike your uric acid and trigger a gout attack. The reality is much less scary. Plant proteins like mung, masoor, and chana are entirely safe for the vast majority of patients when eaten in moderate amounts. Compared to heavy red meats, they are a significantly safer source of protein. Next up is the widespread fear that eating rice is a direct cause of joint pain. People often worry about rice because it is a carbohydrate, sometimes grouping it with sugary foods that cause inflammation. However, rice lacks the specific compounds that trigger gout attacks, and scientific studies show no direct link between controlled portions of rice and arthritis flares. These are simple, innocent staple foods. Unless your doctor has identified a specific reason for you to avoid them, you can enjoy them as part of a balanced meal. The same logic applies to tomatoes, brinjal, and yogurt. A small number of people might have a personal sensitivity to them, but they are not universally harmful to everyone with joint pain. Instead of worrying about what to avoid, we should focus on the foods that actively fight the internal fire. This is what scientists call an anti-inflammatory diet. These are your internal water sprinklers. We are talking about leafy green vegetables, walnuts, flax seeds, and fatty fish. This animation shows why these specific foods are so helpful. They are rich in omega-3 fatty acids. When your body tries to produce inflammatory chemicals, shown here as those sharp red spikes, the omega-3 molecules step in, acting as physical barriers to block them. As those inflammatory chemicals drop, the tension inside your body eases up. That means waking up with less morning stiffness, noticing a drop in swelling, and sometimes even needing fewer painkillers to get through the day. A handful of walnuts won't magically cure your arthritis overnight. But making these foods a regular habit starves that internal fire of the fuel it needs to burn. While we spend a lot of time worrying about dal and rice, we often ignore the things that actually pour petrol onto the flames. The real dietary dangers are excessive alcohol, sugary sodas, deep-fried processed foods, and smoking. These habits aggressively drive up inflammation across your entire body, and they often lead to another major risk factor: excess body weight. Carrying extra weight puts an immense, grinding pressure on your knees, hips, and spine. It is exactly like trying to hike up a mountain every single day while wearing an incredibly heavy backpack. Extra weight also affects you on a chemical level. Your body's fat tissue functions like a factory, constantly pumping out inflammatory signals that keep your joints in a state of high alert, making conditions like rheumatoid arthritis much harder to control. The good news is, you don't need to run a marathon to see benefits. Losing just 5 to 10% of your body weight can provide massive relief because you are simultaneously taking off that heavy backpack and shutting down a major source of internal inflammation. Managing arthritis means looking at the big picture. Your diet is a powerful tool, but it performs best when it is part of a wider lifestyle strategy. To really take control, you need the rest of the team working together, getting regular exercise, prioritizing a good night's sleep, and keeping daily stress in check. And remember our golden rule: none of this replaces your primary treatment. Always take your prescribed medicines and keep up with your regular doctor visits. You can safely ignore those scary, generic messages forwarded on your phone. Because everybody is different, your best strategy is to keep a simple food diary to track what actually triggers your personal symptoms. By tuning out the noise, leaning into science-backed daily habits, and sticking to your medical treatment, you have the power to cool down that fire and take back your quality of life.